Good afternoon. I am Alan Solomont, the Dean of the Jonathan M. Tisch College of Civic Life. To our special guests, to the students who have joined us, and to everyone participating from home, welcome to this virtual Civic Life Lunch. We're excited to have Congresswoman Katherine Clark and Massachusetts State Representative John Santiago, also an emergency room physician at Boston Medical Center, to discuss state and federal responses to the COVID-19 pandemic. I'm sure everyone agrees these are strange and difficult times. So let me say to all members of the Tufts community, students, faculty, and staff, we miss you. We hope you're staying safe and well. We're thinking of you and your loved ones. Just as all of you are finding ways to carry on as best you can, at Tisch College, we are working hard to pursue our mission of educating students for a lifetime of civic engagement. Many of our programs, as this lunch, for example, are shifting to online, and we are helping students find virtual opportunities for civic engagement. Our research teams are looking at how the pandemic might affect young voters in this crucial election year, and we are part of the university's efforts to assist local communities in meeting their needs. Today's conversation, the first we have held virtually, is part of our effort to adapt to these unprecedented circumstances. We're pleased to be joined by two elected officials who are on the front lines of responding to the pandemic here in Massachusetts and across the country. Democratic Congresswoman Katherine Clark represents the 5th Congressional District in Massachusetts, which includes the Tufts University Medford campus. She was first elected to the seat held by then Congressman Ed Markey in 2013. She's been re-elected 3 subsequent times. She brought to Congress a wealth of public service experience as a state legislator, general counsel to the Massachusetts Office of Child Care Services, and policy chief for the Attorney General of the Commonwealth. Congresswoman Clark is a member of the influential House Committee on Appropriations, and in 2018, she was elected by her colleagues to be vice chair of the Democratic Caucus, making her the 6th highest ranking Democrat in the 116th Congress. She is also a member of the Congressional Progressive Caucus and the Women's Caucus. Joining Congresswoman Clark is Dr. Jon Santiago, a Massachusetts state representative from the 9th Suffolk District in Boston, and also an emergency room physician at Boston Medical Center. Representative Santiago is a captain in the Army Reserve and a former Peace Corps volunteer who spent 5 years in Latin America as a community organizer and public health worker. He attended medical school at Yale University, and both as a physician and a policymaker, he is focused on improving the quality and access to care for underserved communities. As a legislator, Representative Santiago serves on the Healthcare Financing and Public Health Committees, where he has also prioritized the opioid epidemic. Representative Santiago is speaking to us from the State House because of a last-minute call for a vote. I want to express my gratitude to both of our guests for joining us, but even more so for their work in recent weeks on responding to this pandemic. And Dr. Santiago, I know I speak for Congresswoman Katherine and all of us when I thank you and your fellow healthcare workers who are on the front lines of this battle. So let's start the conversation with a few questions that I will ask, and then I'll turn it over to students who have some questions of their own. I'm going to go out of order a little bit because Dr. Santiago, or Representative Santiago, was called to the State House to vote for a particular vote. And so my question is this: as legislators, your job is to make laws, exercise oversight, and appropriate. But in these unusual times, you can't easily meet, hold hearings, or vote. Are you worried that this will prevent the Congress and the state legislature and other legislative bodies from making their best decisions? So what can be done and is being done to adapt the legislative process to these unprecedented circumstances? Let me start with Representative Santiago, since I think he is in the process of doing that as we speak.
Well, good morning, everyone, or is it afternoon? I think I've lost track of days and times since the epidemic started. Thank you for having me. It's an honor to be here with Congresswoman Clark, someone who I look up to in the capacity that she has and all the good work she does. She knows my position very well because she was once a lowly state legislator here with us in the House and in the Senate before she made the step to Washington. But you're absolutely right, Alan. It's been a very challenging time. And I've had the honor and the privilege to kind of look at this from two different perspectives. That as an ER doc, as you were discussing, and now as a state legislator. And with respect to what we're doing in the House legislatively, there's no doubt that government had to continue, and the commitment from the Speaker and the Senate President and the Governor himself attest to that. And what the Speaker of the House did, he actually put together a working group of 5 members called the COVID-19 kind of task force working group to really come up with the procedures and the protocols that need to take place in order for the House to meet. And so I happen to be on that task force. And a lot of people have misinterpreted the task force as, what are we going to do about the economy, healthcare, X, Y, Z, which are all important issues. But I mean, the House has deliberate mechanisms for that. They're called committees and committee chairs and a whole structure. But the question is, how are we going to meet and vote? And as you may know, and some people out there, that we have informal sessions and formal sessions. And we've been operating through informal sessions. Now, you can pass bills through informal sessions. However, if one person obstructs that or decides to not have a unanimous vote, legislation is stopped. And so we saw that last week or 2 weeks ago with respect to a fairly progressive housing bill to stop evictions and foreclosures. And so over the past couple of weeks, we've been working on this plan to work remotely, and we just rolled it out. We had our first Democratic Caucus yesterday with the plan, and the idea is to pass the orders today so that Thursday, I guess that's tomorrow, we can go and have our first formal session all electronically. But to come up to design that mechanism was very challenging. There were constitutional, legal, and technological issues. And so a lot of people were involved, a number of different stakeholders. We ultimately settled on a very kind of not too complicated mechanism where it's all really just a big conference call that we're having, and we're using the live stream to conduct it. So a lot of planning, but I think, I'm sure the Congressman would attest to this. The government is here to work, and that's what we're here to do. So I'm here today, and hope, we'll see if we get called in a couple minutes to take a vote on this, but happy to be here.
Let me ask Congresswoman Clark what the Congress is doing to allow it to do its work. And it's more than just a car ride to Beacon Hill.
Yeah, thank you so much. It's so good to be with you. And I want to thank Alan and Tisch College and the whole Tufts University for all the work you've been doing in the community. Tufts has really been a partner in addressing this pandemic, well beyond what you're doing for your students to try and make this as smooth as possible transition to being home and distance learning. You really have just been outstanding community partners. And to John, there is nothing lowly about the work you're doing, whether that's in the ER, and I've so appreciated the blogging and the perspective that you're bringing, and to be able to do both jobs, to be able to see firsthand the devastation. And we know what a toll it's taking on our first responders. So we hope that you are well, and we hope that your colleagues are as well. But just really, our gratitude is immense. And I think that the state has just moved a little ahead of Congress in where we are and working remotely. We are still trying to figure that out. We've been back twice since there's been a state of emergency declared in both Massachusetts and Washington, D.C. The second time we were much more able to have masks provided and hand sanitizer stations as we went onto the floor. But we are still trying to work out exactly how we put into place, whether it's proxy voting or some sort of remote voting, because we want to be prepared not only for doing our jobs now and making sure that we get some of the crucial funding bills that we have. We're going to have another package shortly, and we also have our regular national defense package, our appropriations bills. And so I will probably be heading back next week on Wednesday for our first subcommittee hearing, where we're going to try out those who can come in person, will be in person, and some won't. But all of it requires rule changes and bipartisan agreement, and it's just difficult, even in this pandemic, to get some of those pieces in place. So we're going to keep trying, but I can tell you, I talk to many members of Congress across the country on a daily basis, and people are working very hard. And we really, our offices may be closed, but we're up and running. And we've been able to pass 4 major bills that are here to help families. The first one in early March was really around treatments and research dollars for a vaccine and trying to fund that public health infrastructure. Our second one was the Families First Act, where we made testing for the coronavirus free. And we want to emphasize that testing is not to the levels we want to be at, but it is expanding in Massachusetts, and we want people to know, whether you have private insurance, public insurance, or no insurance at all, you can get a test free of charge. We also put in paid emergency leave. We enhanced unemployment insurance, put money into food security, and also increased our FMAP, which is our federal medical assistance percentage, which is basically an increase in Medicaid programs so that we can serve more people, because we know what an incredible toll this is taking on people, starting with the public health crisis and anxiety about actually getting this virus or caring for a loved one who has it. And then also the ramifications on people financially, as many of our workers are not able to work from home. Our essential workers go from John doing his incredible work in the ER to our folks who are stocking the grocery shelves, who are working in jobs where they don't have the luxury of being able to do them via Zoom. So we are trying to make sure that supports are there for our small businesses, for expanded unemployment. But the need is so outstripping what we're able to provide. And I can tell John, as he's there in the State House, and I recognize those funky chairs in the background there, that you must be right off the floor. But it's having the funding for our state and local municipalities is going to be absolutely key. The states are the front lines, and Massachusetts has been hit very hard by this crisis. We're unfortunately third in the nation, and we need that funding. I hear every single day from my mayors, from state officials, about the hiring they need to do, the services they're putting in place. And to have a Senate and a White House who is unwilling to join us and be able to say, with a very cavalier attitude, we'll just let the states declare bankruptcy, or worse, say we're going to pick this on who we're going to help on the basis of politics and where they think the support for the president is something that we are going to continue to fight. We have to have funding for states. We can run a deficit, states cannot. And it is absolutely essential that we have that funding for fire and police and EMTs and for teachers and all the public health programs that are administered locally. And so we're going to keep this fight going. I hope that in the next few weeks, if not sooner, you will see a package coming out of the House that will be comprehensive and going back and expanding what we've already done, and making sure that states and local municipalities are taken care of.
Let me turn back to Representative Santiago and ask him what the Massachusetts legislature is doing to deal with this pandemic.
So we've done a number of things. We've been in this pandemic for 6 or 7 weeks, and immediately from the get-go, I think we appropriated $15 million and said, listen, we know this is going to be an emergency of sorts, so let's appropriate $15 million. And so that was a big step. We also knew that there were going to be a significant amount of unemployed people. I mean, at this week, I think we're at 650,000 people in Massachusetts who filed for unemployment. I mean, that's a significant increase. I mean, we're looking at a 20% unemployment rate. And if you compare this to 2008, I think the unemployment rate, the highest it got in Massachusetts was 8.8%. So significant difference. So those two things were passed rather immediately because the unemployment insurance, you had to wait a week before you got your benefits. And we were able to essentially scrap that. Two things that I'm excited about was the moratorium on eviction and foreclosures. As you know, despite people losing jobs and the sort, rent is still due the first of each month. And so that was passed just 2 weeks ago. And something that I'm particularly excited about as someone who not only, I'm Puerto Rican, I come from a minority community, I represent a very diverse community. A lot of my patient population at Boston Medical Center, as you're very familiar with, are people from Black and brown communities, was really the focus on data collection on with respect to coronavirus and COVID-19. Because as we know, there are two major hotspots in my point of view. They're the nursing homes, which is no surprise as an ER doctor who receives sign out from patients being brought in, but also communities of color because of the structural inequities that already were present long before COVID-19 was there. And so these two communities were hit hard. There wasn't enough data collected. And so the speaker came out with a statement along with the Senate president saying that we need more data. And we had some concerns with respect to this. So we passed a piece of legislation that does a whole lot for the collection of data, but also establishes a task force to look into how we can address these disparities. So there have been a whole host of other things from liability protections for healthcare workers. For example, 2 weeks ago, I worked at the Boston Hope Field Hospital. I'm credentialed to work at Boston Medical Center. So me working at a different location providing clinical services that would theoretically put me at risk. And so these types of pieces of legislation were passed very recently. And as we move forward, I mean, the big thing that everyone's thinking about is the budget, right? And so in Massachusetts, we're about $44 billion every fiscal year. Because of the lost revenue this year, we're looking at hundreds of millions, if not billions of dollars short in this fiscal year alone. Next year, fiscal year 21, we're looking at $6 billion. And again, if you compare that to 2008, that was $2 billion. So, once we get on the back end of this public health crisis, and I do think from my clinical perspective that we are on the plateau, but once we get on the back end of the public health crisis, the economic price from all this will last years. And I think if you look at past recessions, it's taken up to 6 years to get to, pre-recession, inflation-adjusted kind of revenues. And so that's what we've been working on here at the State House.
If I could, Representative, just tell us a little bit from your perspective as an emergency room physician, what you're seeing at Boston Medical Center, which after all is Boston's safety net hospital, and I'm sure it's happening at similar institutions around the state.
So we're seeing about everything and anything. I've worked Friday, Saturday, and Sunday every weekend for the past 7 weeks, and I've had the, privilege and honor to do my job, but watch this thing progress. And I remember going in 7 weeks ago, and we were talking about COVID-19, but there wasn't really much talk about PPE or the need for it or who really has it. And then all of a sudden, the next couple of weeks, patients started coming to the emergency department with symptoms concerning for COVID-19. And so we had to set up protocols and procedures to really scale up capacity, not just with respect to human resource, but number of ICU beds, number of ventilators, how you accept these people in the emergency department, whether you put up a tent, you screen people. Now we have a system where if an ambulance picks someone up, they call the hospital, and 2 minutes we're coming in with someone suspected. So we have special rooms for them now. And so it's completely changed, with respect to just about everything. And if you think about testing, when people came in, there were very narrow testing guidelines. We didn't have enough tests, and there were strict guidelines. You used to have to call DPH to test someone. And then you used to have to take 2 swabs down someone's nose and someone's mouth, and it was all over the place. Now I think things are significantly more structured, which have allowed us to provide better care. And over the course of the past week, we've actually started to discharge a lot of patients from the hospital. I think we've discharged over 600 people from Boston Medical Center, and up to 35 a day. But we're also seeing the structural inequities take place. At an average year, 60% of the admitted patients at Boston Medical Center are people of color. That's up to 80%. And that's no surprise if you look at the infections in Chelsea and in parts of Boston that are primarily people of color. And so it's been challenging, but the morale is still there. We're very proud to do our job, and people who work in the ER were just tough to begin with. I mean, whether that's gunshots, stab wounds, we kind of thrive in that environment. And this has been challenging, but we've been in the fight.
As you know, I was born at the predecessor hospital, Boston City Hospital. My mother was a nurse there, so I have a special affection for that institution, and thank you. Congresswoman Clark, could I ask you to rate the federal government's response to the COVID-19 pandemic?
Well, it's mixed. I think that part of the problems we're having are with the White House and this administration, who first declared this a hoax and has been giving out mixed signals, we'll say, at best, about the severity and what needs to happen. And so we are behind. We're behind where we need to be in testing. I absolutely, we are imploring our colleagues in the White House to continue to invest in the American people and to make sure that they understand this is a public health crisis. And if we fix that, if we address the public health crisis, if we put in the testing protocols that we need and the tracing programs that we need to make sure that we can get a handle on infections and bring them down, then we can begin to safely reopen. But this idea that we can, as the president says, magically one day this will be gone and we're just going to reopen. Everybody wants to get back to work. Everybody would love to resume normal life. But there have been tremendous sacrifices made, not only in human life, but in giving up small businesses and staying home and having to do with less. We've seen our hunger and housing issues skyrocket, as John was just talking about. But that's all going to be for nothing if we reopen too soon. So the federal government has to stand ready. We are the entity that can help states, help the local response, and help the American people get back on their feet. But we have to do it by following science. We have to do it by following medical advice. We can't poll test our way out of this. We have to make sure that we are being serious about the research and looking for treatments and a vaccine. But at the same time that we're doing that, we have to make those plans for if a vaccine is developed, how are we going to get it rapidly available to American people in an equitable way. And as John said, this pandemic has just shown so many of the social justice fault lines that we already knew were there, whether it's access to health insurance, to housing, to safe job conditions, racial disparities. All of this are things that we have known and been working towards. So, at the same time that we see this going on and this health crisis meeting the American people, we have an administration that is still pursuing stripping away health care for millions of Americans by undoing the ACA. So our grade is mixed. I think that some of the programs that we've been able to do in a bipartisan way, the expansion of unemployment, the stimulus checks that people are getting directly, the small business administration loan programs are a good start. But we have to keep following the science and make sure that our politics aren't getting in the way of what we need to do to end this public health crisis and make sure that we don't see a huge resurgence in the next few months if we open too early and against the best medical advice. And at the same time, and I know an issue very close to Tisch College, we need to be looking ahead, and I'd give us not a very good grade at looking at our democracy and how we are going to protect it going into November. We're going to continue to push in the House for robust mail-in programs And that starts by getting states specific funding so that they can expand them, like here in Massachusetts, or start from scratch. But we're running out of time. And we also have to make sure that we win the fight with the White House over supporting the postal system. A mail-in program isn't going to work if we continue to cut off funding for them and not realize that they too are essential workers in this, and that so many people around the country, and certainly here in Massachusetts, are relying on the mail more than ever to get prescriptions, to get checks, to get income into their house, and to be able to go about their daily lives the best they can. That U.S. mail is really a lifeline for so many. And so we need to do both things, protect them so that we can protect our democracy.
Well, you anticipated my next question, because I wanted to ask, with the election season coming up this fall, and actually primary elections over the summer, I wanted to know what is being done at both the federal level, which you addressed a bit, and the state level to ensure that everyone can participate safely in our democratic process. And I know there are some bills that have been filed in the legislature around vote by mail. So let me ask Representative Santiago, where is the state legislature and the state government in terms of making sure that people can safely vote in Massachusetts elections come the fall?
Well, I think a couple things. As you're probably well aware of, the access to ballot issue for candidates has been significantly reduced, right? I mean, there's a fine balance between how do you promote ballot access and how do you show community support. And so over the course of the past 2 weeks, I want to say, the SJC said the number of signatures have been halved from federal to local elections. And the state has been also extended the deadline to May 5th, as opposed to April 28th as well. Now, with respect to voting, absolutely right. I mean, it's important that government continues to function and that we continue to hold these elections. And so I think a couple of things. I think it's how do we expand early voting, just the number of days and the number of sites as well, but also consider mail-in votes as well. Now, there have been 2 proposals that have been sent from the state Senate as well, and one from the state, the House of Representatives, that they're in the process of going through the committee hearings and that sort of thing. We're still doing committee hearings. I mean, they've been largely done by Zoom or some other teleconference application. But my guess is that the reason why we have to go into this, install this program to remote vote that we're embarking on today and tomorrow, hopefully, so we can take up some of these more comprehensive and robust bills that, you could see easily someone walking into the chamber and stopping the bill in an informal session if they didn't like it.
Yeah. And I gather the debate in the legislature and in the government is between opt-in and opt-out in terms of vote by mail.
Sure.
Is the Commonwealth going to mail a ballot to every voter in Massachusetts, or are you going to have to request it?
Sure.
But let me move on and ask both of you, but let me start with Congresswoman Clark. What can we as citizens do to help in this fight? What can we do to help others? And while we still adhere to the social distancing guidelines, many people want to know how they can be part of this who aren't healthcare workers. What's your advice to ordinary citizens, students, whatever, who want to help?
Yeah, I think that we are isolated in our homes, but we're not alone. And I think one of the best things that we can do is to reach out to our neighbors, check in with one another, make sure that everyone's doing okay. One of the silver linings to this is the ability to use technology like this to make sure that we are connected. It is especially important with seniors in our lives, with older people, that we check in if they are able to do it with video. It is very reassuring to actually be able to see people and feel that connection of seeing their faces, if that's possible. There are also volunteer opportunities. I know that Tufts has been helping coordinate some of those, and there are opportunities for many folks to be able to help out at local food pantry is an area of great need. And I gave blood earlier, and it was lots of safety measures involved, but that is also a need that we can't forget in times like this. So many blood drives have been canceled, and it's still a way that you can help and give back. But there are many hotlines that need volunteers. So there's many ways to reach outside of our homes and have a real impact. And I know that people are so grateful to our first responders and to our people, everyone working on the front lines, but there are ways to do it. I have a fantastic neighbor who's made over 2,700 homemade masks just to make sure that everyone who needs one, who's caring for, in-home healthcare folks really have been challenged with how to get protective equipment. And so there's lots of ways that people are finding to contribute and connect, and just take good care, and don't forget to go outside. And we finally have some sunny weather today, so it's a good day. But it's really those connections.
My wife and I saw the picture of you after you gave blood with a red band on your arm, and you inspired us. We plan to follow suit. Let me also say to the members of the Tufts community that are part of this, you can go to the Tisch College website and find volunteer opportunities that you can do remotely. So thank you for mentioning that, Congresswoman. And let me ask Dr. Santiago, I want to keep switching your title. What would you say to citizens and students about what they can do to be helpful?
I think my main message is that we all have an important role to play in this, and it's going to require an all hands-on deck approach. I happen to be an emergency room doctor, but this is something I was educated and trained to do, so I'm just doing my job. But there are so many people out there, whether they're the parents homeschooling their kids, the grocery workers, the essential workers that didn't ask to take part of the pandemic, but that are still being involved. And just to double down on what the Congresswoman was saying, a couple of weeks ago, I got a phone call from another emergency medicine doctor that says, if the gunshot comes in or the stab wound comes in, theoretically you would give them blood from the get-go, but now you might want to start off with some crystalloid before you give them blood because there was a blood shortage. And so I gave blood like a month ago, but giving blood, but also realizing that the American people, by and large, are just as innovative and just as smart, and just as creative, even if we can't be physically located by one another. And so just last night I was on a neighborhood call with some neighborhood groups, and how they're still invigorated, setting up a neighborhood watch when things get better, and just their sheer optimism and desire to get involved is it's uncontested. And so I see it day in, day out, and that's what actually inspires me to do what I do.
Yeah. I think we'd like to open up the conversation to some of our students who are on the line, who have some questions. And I wanted to mention that all of our students, the few that are going to ask questions, are recipients of this year's Presidential Award for Civic Life. This is the highest honor that Tufts bestows for civic leadership on campus. It's given to a very small group of exemplary graduate and undergraduate students every year. And so I want to congratulate the students that are going to be asking questions. I would also ask them as they appear, ask your question. Please remember to introduce yourselves, to let us know your name, your class year, what school at Tufts you're from, if you wish, where you're currently located. I suggest, just so we can move through this and hear from both the representative and the Congresswoman, to direct your question to one or the other. And so our first student questioner is a graduating student from the class of 2020 at Tufts University School of Dental Medicine.
Hello, everyone. Thank you so much. My name is Amanjot Sarao, and I first just want to say thank you so much to everyone that made this meeting possible and the opportunity of being here today. And thank you to our wonderful guest speakers for just the honor of meeting you and also the chance to ask some questions. So my first question would be to Congresswoman Clark. So many of us are glued to our news channels trying to make sense of this pandemic and what exactly happened with the US response to it. So something that we've been seeing a lot in the media, I know it's hard to believe everything, but something we see is when there were warnings about the severity of the virus back in January and February, it seems as if the political agenda in the US was more focused on other issues such as the impeachment. So it just seems like many Democrats or Republicans didn't rally around the public health response to what was happening in the world. Could you maybe share your thoughts on this?
Sure.
I'm going to let Congresswoman Clark take this question.
Thank you. Thank you for your question, and thank you for joining us today. I can tell you that I did not receive really briefings about this until February, although it has come out now that the White House did know. I think part of what has delayed the effectiveness of our response and why we are behind in testing is that this was downplayed by the president, who called this a hoax and said that this was not more serious than your standard seasonal flu. And I can tell you that in hearings I had at the end of February, it was very disturbing as we were beginning to see this impact, and for the numbers starting to rise, especially in Washington state, that the Trump administration had proposed cuts to the CDC of over $700 million, cuts they stand by today as we go into appropriation season. So, we can always do more, but I think what we have to do is, we want to look back and look forward at the same time. We have lost time and we have lost ground, and it has cost us lives. But we need to be united in saying we are here now. It is not too late to do the best we can for the American people. And that means dramatically increasing our testing and tracing capabilities to make sure we can reopen our economy safely and we can save American lives. It means working with global partners around the research and what we are going to need, hopefully, to develop a vaccine and to develop treatments, because we know that this is going to continue to infect people as we go. And we have to work in a bipartisan way, but we've already seen that when you get talking about trillions of dollars in aid going out, we've already seen that that is not always going to our intended recipients. And so the oversight from Congress is going to be critically important. And I wholly support Speaker Nancy Pelosi's proposal that we have a oversight committee that's operating now, that we don't just look back when we're out of danger, but right now we are doing real-time assessments of where we are and where we need to move funding to truly address the public health crisis. So we have to work together. This virus doesn't care what your voting record is and which party you support. And we need to remind ourselves that we're in this together. And that's why I find some of the rhetoric coming out around we're only going to help those states that have immigration policies we like as so dangerous and so disheartening and so un-American and sort of against all our values that we try and uphold, that we wouldn't do everything we can. And with any sort of health crisis, it's really heightened our awareness that we are only as healthy as every other person is. And that, we can't say to any group of workers, you have to go to work, whether that's in a meat processing plant or stocking our airplanes with beverages and food, but we're not going to give you those health protections. We have to remember we're only as safe as every single worker is safe in this country and every single person, and it's just underlying our need for expanded access to health insurance and health services in this country.
Thank you. Why don't we move to the next student questioner?
Oh, I think.
Sorry.
Yeah, I think I'm allowed to ask one more question. Obviously, there's a lot of
higher authority. Why don't you ask this question to Representative Santiago?
Okay. Yes, actually, this could go to both. So I do have a question since I am a graduating student. For many students graduating in the healthcare field with sometimes over like $500,000 in debt, we either obtain employment or are in a residency program right after. So during this pandemic, the CARES Act has allowed for suspension of payments to federally held loans through September 30th, 2020. So I guess I'm just a little confused on how was this date really decided when we don't really know how long the pandemic could last. And if it is set to be September 30th and recent graduates cannot obtain employment given the financial hardships of dental offices, healthcare offices, or even the fact that the nation can't really determine when is it safe for providers to go back to work, to perform elective or emergent care, how are graduates still expected to make those loan payments after September 30th then?
Well, I'm going to ask Congresswoman Clark to respond about the loan suspension of payments specifically, but I might ask Dr. Santiago to give us his sense of the timing of and the arc of this pandemic, if I may. But Congresswoman Clark?
Sure, I'll try to be brief. The September 30th was picked as a way to get about 4 months worth of funding, but it is not a magic date. And I think that we are going to need to extend it. There's been a lot of interest that I've heard from constituents on also broadening who is eligible for it, to make sure that we are really capturing everyone who's struggling with student debt. And I'm joining forces with our Senator Elizabeth Warren and others who are also calling just for forgiveness of student debt in this time. That's really what is needed to help our students who are just graduating or who are, we're already working and paying a student debt load out in this time. So I think it's long past time we look at a very different approach to how we finance colleges and take burden off of our students and those just entering the workforce. And some people have been in the workforce for decades and are still paying student loans, and make sure that we are not forgetting that debt burden as we go forward.
Dr. Santiago, any advice to young graduates of dental school or medical school about the arc of this crisis that we're facing? Oh, I think we have lost the audience.
There he is.
So first and foremost, if you're entering the healthcare profession, you should feel privileged and honored. It's an incredible job to sit down with someone who you just met and to hear their story and to learn how you can be helpful, and to realize that it's not all the time in your dental skills, your medical skills that's going to heal someone, but the conversations you have and the empathy that you can display and how that can go, that can count for a lot. But with respect to how long we're going to be in this, that's the $1 million question we're all trying to figure out. And frankly, who knows? What we do know is ultimately we have to get to a place with sufficient herd immunity, the idea where enough people have immunity where the transmission of the virus is limited and halted. And so depending on how infectious the virus is, the higher the infectivity rate, the higher the level of people have to be immunized. And there's only 2 ways to get immunity, right? Either get a vaccine, which we're about a year away, or you get infected. That's assuming that a previous infection confers immunity, which we're not 100% sure, but we suspect it'll provide some immunity. But in lieu of that, which we're nowhere near any of that, you're just gonna have to test like hell and contact trace along with that. And so now as testing is ramping up, hopefully there's gonna be a lot more. I mean, there's some estimates that say that we have to get up to 30,000 a day in Massachusetts and have the subsequent contact tracing to do what we need to do to open up the economy. Right now, last week or so, we were at 5,000, 6,000, 7,000. We had a couple in the tens of thousands. We have a lot more to do when it comes to testing and who we test and how we go about testing. And the contact tracing, I mean, Massachusetts is about to embark on probably the most intense contact tracing in the whole country in collaboration with Partners in Health, which is an amazing organization. So there's a lot more to do. And the concern is that you're going to have a secondary surge. And you see places like Singapore, for example, and you look at some of the Asian countries that they had lockdown policies. They did pretty well contact tracing. And now Singapore is having a secondary spike that's looking to turn pretty bad. And so it's a very delicate question. But what we know right now is that more testing and more contact tracing is needed.
Thank you. Next question.
Hi, my name is Anthony Norman. I'm from the Tufts University School of Medicine, class of 2020. Thank you guys so much for everything that you do and for your help and for letting me speak to you today. My question is, as has been alluded to in this conversation, COVID-19 has affected many communities, particularly low-income, densely populated cities, including my hometown of Chelsea, Massachusetts, which as of yesterday had over 1,900 cases, a population that's about 40,000 people. But I think this crisis has further brought to light that there some of the issues surrounding income inequality, affordable housing, overcrowding, health disparities, and more. Has there been a reinvigoration to look more closely at these highlighted issues so that way it doesn't take a crisis to, let's say, bring them more to light, or the fact that it puts them at such a disadvantage?
So let me ask both the Congresswoman and the representative to comment briefly on, from your perspective, from the federal government's perspective and from the state government, has this increased our sensitivity and, more importantly, the likelihood that some action will be taken? Congresswoman.
I'll start. I certainly hope so. You know, as we've said before, there are so many disparities and inequities that we've seen in both healthcare, in job conditions, in housing, in access to food and to the ballot, that this pandemic hasn't created, but has certainly revealed in stark contrast. And I think that this is an opportunity for us, one that we wish we didn't have. We grieve with people who have lost relatives and friends, and we grieve as communities for all that we have lost. But it is also a chance for us to recommit to those issues and to make sure that people like you who are going into the medical field are able to do it and balance student debt, are able to make sure that communities of color have the same healthcare outcomes that other communities have, and that we address some of these fundamental social justice issues with renewed urgency. And this pandemic has been in many ways has held up a mirror to where we have fallen short. And it's not that we didn't know these problems were there, but I hope that this is going to renew our commitment to really reevaluating and to put people first again in our policies and really heighten their priorities and amplify their voices in Congress and in the State House, because we've seen how these policies play out for people and the deadly consequences they have by much of the inaction and failure to address these long-standing inequities. So we've got to do it together. We are going to need to push. There are tremendous forces that don't want to change, that want to keep the status quo, but we have to take the lessons and the lives that we've lost and honor them by really reevaluating where we are as a country and reprioritizing what it means when we say, you know, equality for all and justice for all. And I think we can do it. And I think we're going to need a lot of push from outside of the Beltway to get there. But it's going to begin with being active voters in the fall and making sure that we're holding everybody accountable to never letting these disparities play out again in such a deadly way. And this won't be the last pandemic that we face as a country. It won't be the last economic crisis. But let's take these lessons and really renew our commitment to making sure that our response and the ability for people to weather the next crisis is not dependent on their income or their race. And so we're going to work together, and we need you. Congratulations on where you are. And I'm also so sorry to say, Alan, that I have to jump off this call and move on to another press conference on getting state and local aid to you, John. But thank you all again. I really appreciate the students and Alan and John for putting this together. Your work in partnership is how we get through it. And I really appreciate the opportunity to spend some time with you today. Thank you.
Thank you very much, Congresswoman. We appreciate your taking the time. I'm going to ask if Representative Santiago can stay with us for just a couple more minutes where the students ask the last question. But we appreciate the Congresswoman's role in Washington, the role in Massachusetts, and the close relationship that we enjoy between the university and her. So we have three more students who have joined us. I'm going to ask them to ask their questions very briefly, and then I'm going to let the representative answer any one of them that he chooses, all three, whatever we have time for. So go ahead.
Hi there, my name's Grace and I'm a master's student at the Tufts Friedman School and in the Tufts Public Health Program. I'm wondering, Representative Santiago, if you have any advice for students that, like myself, who were or tried to be engaged in state level politics in the policymaking process that are now confined to our apartments, and just wondering if you have any advice for the best way to advocate for priority issues affecting my community in these unprecedented circumstances.
And I'll ask for the next question from a student.
Hi, good afternoon. My name is Harry Kong, and I'm an undergrad student in the School of Arts and Sciences, class of 2020. Thank you for being here. And my question for Representative Santiago is that what are some of the ways in which the COVID-19 outbreak has affected how you conduct your day-to-day business in your own role? I'm actually calling also from Milton, Massachusetts, so I'd be really curious to hear how the outbreak has affected what's happening at the Massachusetts State House.
And our last questioner.
Hi, my name is Daniela Sanchez. I am also an undergrad in sciences.
Yeah.
My question is actually really specific to the virus itself. And in terms of the unique healthcare system in the United States and conditions that we have, health conditions that maybe aren't present in other countries, how is that affecting the way the virus is affecting our people in this country specifically?
Great, so question number one, how does a master's level public health student get involved, remain involved? And, you know, I always look at crisis situations as not so much as a crisis, but more along the lines of an opportunity. And, you know, I do that medically, you know, when the crazy trauma patient comes in who's sick. And, you know, I think we as emergency medicine doctors, we thrive in these situations because we're always looking for opportunities. How do we save lives? How do we think quick on our feet here? And I think this opportunity in this crisis has provided that. And, you know, back to, I think, Anthony's question before this, you know, I wrote 2 op-eds in the Globe with respect to this, is like, let's use this time to really focus on opportunities and how we can address the issues that we're seeing right now. So whether that's, I mean, this exposed a glaring issue when it comes to housing insecurity, food insecurity, you know, just unequal health standards. And so how you can get involved as a master, you know, level public health student. And let me just say, you know, although I'm an emergency room doctor, my heart of hearts is in public health. Like I want to get to a situation where I essentially put myself out of a job, essentially, because I believe in public health, and, you know, I have a master's in public health, and that's what I want to do. So there are a number of ways to get involved. I would, you know, there's the policy and there's the advocacy perspective. I think getting in touch with your local state representative, state senator, and their committees to see what they're doing on the public health committee or healthcare finance committee could be one avenue. That's how I got started. I interned at the State House when I was a medical student, and I started to learn the game and how things work here, because what you read in books, particularly at a master's level class, is completely different to what happens in the policy circles at the State House or in different organizations. There are also a number of great organizations doing tremendous work, the Massachusetts Public Health Association, and you name it. And so what I did when I was in college, when I was in grad school and med school, I just kind of just tagged along with these groups. And, I didn't offer much. And, I'm a big believer, no job is too small. And so I just wanted to be a fly on the wall and listen and learn. And that's how, I ended up here. And those experiences really paved the way for me to kind of end up in this position and change the way I think about public health and medicine and politics. So question number 2, how has the coronavirus changed like my workplace environment? So in a lot of ways, the State House is essentially closed to the public, because of the concern that people were getting infected and there were staff getting infected, elected officials got infected as well. They essentially closed down. And we said, let's not put our staff in danger. Let's not put ourselves in danger. So let's all work remotely. Luckily, we all have internet at our house and able to conduct these meetings and these community hearings publicly. So we essentially closed down the State House. And so even now, there's a few of us here because we have to come and vote, but it's not 160 people. There's a few of us. And what I love about the State House is it's such a social environment. You go down to the chamber, everyone's talking, everyone's high-fiving, but you can't do any of that now. And so if I just walked to the chamber, before this call, and everyone was sitting in their own respective seats, like 10 miles away from each other. And so it was just awkward to see that, you miss the hugs and the kisses and the laughs. And so it's challenging. We all wear masks here. There's hand sanitizer everywhere. And you actually can't even walk down to the well. It's roped off and cordoned off. And as I mentioned when I first got on the call, we've changed the way we voted now. Now we're looking to install a plan to vote remotely, and hopefully that'll go live next week. The third question was how has the virus affected Americans, and like why are some communities hit harder than other communities? Is that what it is kind of? So for a lot of reasons, I think the virus doesn't see race or class, right? The virus is just a virus. It just needs a host. However, the conditions of certain communities or people or populations are such that they lend themselves to being easily exposed to this. So back to what Anthony Norman, the previous guy that was from Chelsea. In Chelsea, you have a city of 40,000 people in a very dense environment. I think it's 2 square miles. So people are living on top of each other, and that's what you have in New York. And these are, on the whole, poor people, low-income people, immigrants, people of color, people, a lot of them are disproportionately Spanish-speaking, disproportionately essential workers, disproportionately living in intergenerational housing, where the grandparents live with the parents, live with the aunts and uncles. And so when you create social systems like that, that put people in contact with each other, you're more likely to pass a virus that's passed on from one person to the other. And so it's how do we get to those issues from a public health, from a policy perspective, to address housing insecurity, food insecurity? Why can't we give these people good, jobs to pay good wages? And when that doesn't happen, that's when these communities get hit the hardest. And it should be no surprise. This happens with every disease process, right? The poorer you are, the more likely you are to get sick from whatever the disease is. And this is something that I've been involved with, health disparities, long before I was a physician. In fact, that's how I started. I had an uncle who got HIV, and my uncle was not your standard back in the 80s. He wasn't a gay white guy, hemophiliac. He was just a Latino guy who was poor. And as a result, he was involved with a crowd that whatever injected drugs, and he got HIV, and he wasn't able to get the care that he needed because the health disparities and issues with respect to access. He ultimately passed away, and then his son, my cousin, became an AIDS orphan. And I'm thinking, like, how does this happen in Boston, Massachusetts, the mecca of healthcare? And that's what really turned me on at a young age to public health disparity, and that's why I'm doing what I do now.
Well, thank you very much, and that's a fitting close to our very first virtual Civic Life Lunch. I want to thank the students who joined us and asked questions. I want to thank our guests, both Congresswoman Clark and Representative and Dr. Santiago. Appreciate your time, your insight, and most of all, the service that you're providing both to the Commonwealth and to patients every day. To everyone watching, thank you for tuning in. Stay tuned for more events like this by checking our website, tischcollege.tufts.edu. That's tischcollege.tufts.edu. Our next Civic Life Lunch will be Thursday, May 7th, featuring Amanda Littman, who's the executive director of an organization called Run for Something, which encourages young women in particular to run for something, and especially to run for local and municipal state offices. In any event, we appreciate everybody's participation and also their indulgence with our first experiment with this technology. We appreciate everyone. I hope you'll all stay safe and healthy. And we look forward to the day when we can reconvene in person and high five each other. But have a wonderful day. Thank you so much.
See you guys. Thanks, Alan.